And welcome back to Live Well. I'm your host, Lisa Kirsch. We have a returning guest here. We love it when Dr. Shaw comes in to visit. He is from Beautologie. Thank you for coming back. Always great to see you.
Oh, thank you so much for having me.
A lot of fun
coming.
to have you on the show.
Thank you.
Well, we have a lot to talk about today, so let's jump right in. And
Okay.
this thing we're hearing about now is called manscaping.
Manscaping,
So
yes.
how often do guys come and seek some sort of a procedure?
It's becoming a lot more common nowadays. The ASPS just reported a huge increase in number of men looking for procedures. It's becoming more and more considered accepted now for men to do some of these things.
What type of procedures do you offer here at Beautologie?
So, Beautologie offers everything from laser hair removal up to liposuction and surgical procedures. We really try to tailor our procedures for men so that they feel comfortable having these procedures done.
Sure.
And, really for their body types. Operating on a man is very different than operating on a woman. The skin is tougher, they are more fibrous, they have fat in different areas, they also have hair in different areas, so it really has to be customized for the male.
And I was reading something about male sculpting. Is that just the all-over process, or is that a particular procedure?
That's a particular procedure, actually. It's liposculpting. And and so, men get fat in different areas that accumulates than women do. Women get fat more in their lower abdomen, maybe in their thighs. For men, it's more in like their love handle area, sometimes in their chest area. We call that gynecomastia. And liposculpting removes the fat that's hard to get rid of with just diet and exercise.
And these are procedures that can be done, and then these gentlemen or ladies can return to work fairly quickly nowadays.
Exactly. I mean, everything is getting so much less invasive. The recovery time is going down a lot. It used to be like you had to stay in the hospital after procedures like this. Everyone now just goes right home after a couple nights at home in bed. They can pretty much, most people after liposuction, liposculpture can go back to work after a weekend or so if you have like a desk job.
That is amazing.
Yeah.
And I know you've also made some additions and some changes to the business, to the website, to make it more man-friendly, for lack of a better term. How does that work? What have you done?
So, we had a lot of feedback on our website that, it is more geared towards women.
It's lovely.
Thank you so
Yes.
much. Actually, we're launching a brand new one in a couple of weeks, and people are going to love it. A lot more videos of procedures and things like that. But we also launched a different website called Beautologie for Men, and we really focus in on the things that men are very interested in. And some of them don't even necessarily apply to women a lot. One of them, for example, is hair transplant. We do a lot of hair transplant in our facility. Laser hair removal of the whole body. A lot of men are seeking that out too now. Liposculpture, like we talked about. Lots of things geared more towards men.
And I've seen some advertisements and heard some talk about some kind of fat freezing
Yeah,
technique.
Scott and I were just talking about that this morning.
That's
yeah,
right, okay.
And basically, it's a non-invasive way to get rid of fat pockets that are resistant to diet and exercise. So what we use is a radio frequency device usually for men, it's on the back of the waist, and we use the radio frequency to basically break apart the fat cells under the skin, and then your body absorbs it.
Now, a great place for people to start with questions, I'm sure feeling maybe not so embarrassed versus maybe walking in, it might be uneasy with that, would be online.
Yes, absolutely.
And then a consultation would be the next step.
Absolutely, and for a men patient especially, we really just focus in on what they're looking to do,
Right.
help them with that particular concern. We really tailor a consultation for men as well, and of course, with everything in plastic surgery, there's a whole spectrum of things you can do. You can do non-invasive things and more invasive things. The recovery time goes from minimal to longer, and so we really have to find the best procedure for what that person is looking for, and their recovery periods and things like that.
And the results, and if
the
they're even
results.
feasible. Because sometimes people, show you maybe a magazine and say, make me
Yep.
look like that.
Yep, absolutely.
And there's only so much you can do.
People are
I would love for you to make me 6 inches taller, but I know that's not going to happen.
Yeah, that's not a procedure that we do yet.
Yet.
But
Yet.
One thing I can tell you is people don't realize we actually recommend pursuing other avenues or not doing surgery for almost 30% of the people that come and see us. Because we always want to do things that are going to work. And if they're not going to work or be marginal or cause any kind of risk in any way, we always tell people, this is not the right thing for you to do right now.
Because surgery, as I heard you say this morning on Scott's show, surgery is still surgery. And I think sometimes
Exactly.
people lose that. And what are
Exactly.
some of the risks then?
Of which procedure? The liposculpture you're talking about?
The most invasive one, maybe?
Yeah,
that
so
you
let's talk
offer?
about the liposculpture for men.
Okay.
And some of the risk of liposculpture is with any surgery in the world, there's risks of infection, bleeding, and there's risk of pain after the surgery. We, of course, minimize all these risks. I told Scott, and you should come visit too, our surgery center is like a little mini hospital inside of our building. And we don't do surgeries with infections there ever. So unlike a hospital where people get things like MRSA and all these other infections that are out there, we don't even do them at our surgery center. So we pretty much eliminate the risk of getting any kind of infection from our surgery center. The other risks of bleeding is also minimized by a fluid that we put inside the body before we do the liposuction that really cuts down on that. And then as far as pain goes, the way we do the procedure with the tiny cannulas that we use, it pretty much makes it almost a painless procedure. It is going to be sore, I won't lie, but it's not like what you would think would be something that is not tolerable. Most people just sleep through it for a couple of days.
Okay.
Yeah.
Where are you located for those who don't know?
We're located right here right off of Truxton Extension on Commerce Way, 4850 Commerce.
How long have you been here in Bakersfield?
Oh, we've been here since 2002.
I was going to say, I think I remember when you guys came to town.
Yeah,
And business is good, and I know you enjoy the support of the community.
Yeah, I love I love what I do, and it's always fun to be part of Bakersfield, and we're out there a lot, and we really try to participate in all the community events we possibly can. So people see us all over the place, so it's great.
Well, you also brought in some props for us today, because last time you were here, we were focusing
Yep.
on breast augmentation
Right.
and the different stages, the different procedures, the different products that are now available.
Right. We talked a lot about the new silicone implants that are available, and I really wanted to bring them in to show
Sure.
to you. This is a saline implant.
Okay,
Go ahead
so
and feel that.
This is saline. This
That's
is
saline.
old school. Do you
Right.
still even use these anymore?
We do actually,
Okay.
and saline is good still in a lot of different circumstances.
Okay.
And I want you to feel this is the new silicone implant. You can feel it feels a lot softer
Oh,
and
it
more
does.
natural. Right, exactly. Now, the nice thing about saline is if you notice, we have this little valve here on the implant, so we
Mm-hmm.
can put saline in and take saline out of the implant if
Oh.
we need to, and that's really great for people that have a size different between their breasts. We can really adjust the size using saline implants. It does feel a little bit more firm, as you can tell, right?
Absolutely.
Yeah,
it does.
and it does have a little bit more of what we call rippling. You can see these little ripples on the implant.
Uh-huh.
And the silicone implant is more of a smooth shell, right? So most of the time we're doing silicone now because it is softer. It is less ripply than the saline implants. However, saline still works great. I mean, there are tens of thousands of women out there with saline implants in Bakersfield, and they still love their implants. As long as you have an adequate amount of tissue covering the implant, you're not going to feel the ripples, and you're not going to feel the firmness of the implant.
Why would you recommend one over the other?
I recommend the saline implants for people that have a size difference, for
Okay.
example. They're
Because
more
you can't
easily
adjust them.
adjustable, right?
Sure.
Exactly. People that want a rounder, more fuller look, the saline gives you that look. The silicone tends to look more natural.
Right.
Yeah. So it's really customized to the patient. So, whenever we do a consultation, what we're going to do is we're going to evaluate the amount of skin and tissue they have in their body and guide them towards the right implant. We make measurements to see if there's any size difference, and then we guide them towards the right implant.
And something else that I know that you do offer there is because my question to you was, well, how do you know before you sign on the dotted line to do this that it is something that's going to look okay? You can't just try these on like you can in a bathing suit in a store.
Well, you can, though.
But you can.
Yeah.
Tell us about that.
So we have a special bra that we use, and we have every size implant there in our office. And what we do with every patient is we have them try it on. We have them look in the mirror. We put different sizes on each side so they can see what the sizes look like. And we have a special, shirt that they can put on top to see what it looks like in clothing. We take pictures for them on their cell phone so they can kind of look at it later on, show friends and family. It's very important to do that. You really want to feel comfortable before you go into surgery with the size of implant that you're choosing.
And what age groups are we seeing with the reconstruction, with the implants, with just the implant versus the lift?
Yeah.
It really goes 18 to
people are very
60.
surprised. People are very surprised. It's really not 18-year-olds. I mean, there are some 18-year-olds that do it because maybe they were born with very little tissue and it just bothers them. Most of our patients, I would say 80% of our patients are women that are done having children or in the middle of having children. And because of breastfeeding, they've lost some of that volume.
Right.
So I would say 80% of our women are just in the middle of having children or done having children. And then maybe another 20% are kind of the more extreme age groups, older and younger. younger.
And if people have questions, where would you suggest they start looking for those answers?
The best thing to do is just go to our website, Beautologie.com, or give us a call, schedule a consultation. With our consultations, there's no commitment
It's
at
not a
that time.
high-pressure
Right,
sales
exactly.
pitch.
We just want you to have the information, and you decide if it's right for you.
For men and for women.
Absolutely.
And do you think you're going to continue to see this trend going with men coming for?
I do. I think, the internet is interesting because it really gives you a basic amount of information that's applicable to everybody.
Right.
And then when you come in for a consultation, you get information that's specific for you. So I think more people feel comfortable when they have some of the information and they find out whether it's right for them or not right on the internet. And then it makes them feel more comfortable coming in for a consultation.
And what is that website?
Beautologie.com.
Beautologie.com.
Or beautologieformen.com.
Oh, the new one.
Yes.
Has that launched yet?
Yes. Oh, yeah.
And that's up and
Yeah,
ready
it's
to
out
go.
there, yep.
All right, Dr. Darshan Shah from Beautologie. As always, we thank you so much for coming in and sharing your time and your expertise
you.
with us. We hope to have you back soon.
Absolutely.
And again, to our viewers today, thank you so much for watching Live Well. We'll see you next Wednesday right here on Bakersfield.com.